demonstration, I will be playing the role of the dentist. During the emergency, the dentist plays the role of P1, in which I will stay with the patient and perform all appropriate emergency treatment for the patient. For a myocardial infarction, it is vital to recognize the signs and symptoms because prompt treatment increases the patient's chance of survival. I will now be going over signs and symptoms of acute myocardial infarction. So the classic symptom would be chest pain that lasts 20 minutes or longer. A patient might experience pressure, tightness, heaviness, burning, squeezing, crushing sensation in the middle of chest and or lower 1/3 of epigastrium. The pain may start in the chest and radiate down the arms, shoulders, jaw, or back. More symptoms will include weakness, dyspnea, diaphoresis, irregular pulse, nausea, vomiting, a sense of impending doom, and clutching the chest, which is also known as the Levine sign. It's important to know that not all signs and symptoms are the same for everyone. And women and patients with diabetes do have different symptoms. For women, it is atypical discomfort, abdominal pain, shortness of breath, and fatigue. For patients with diabetes, they suffer silent MIs. This will feel like discomfort. The condition is discovered at a later time following a more severe episode. The signs associated with it are shortness of breath, dizziness, altered mental status, and or arrhythmia.
Hi, my name is Jordan, and today we're going to demonstrate a myocardial infarction dental office emergency. In this scenario, I will be playing the patient, and I will demonstrate someone undergoing a heart attack and the most common signs and symptoms. An acute myocardial infarction, also known as a heart attack, is necrosis of a portion of the heart muscle due to a total partial occlusion of a coronary artery. It can be caused by atherosclerosis, a thrombus, or a spasm. It can form rapidly or over a long period of time, and if not treated, it can lead to cardiac arrest. Acute myocardial infarctions can cause cardiac dysrhythmias, which are irregular heart rhythms, and they may occur after a heart attack, and they increase the patient's risk for death. Examples of cardiac dysrhythmias include bradycardia, which is a slow heart beating rhythm, ventricular tachycardia, which is rapid contraction with inadequate ventricular filling, ventricular fibrillation, which is disorganized irregular contraction of the ventricles, or asystole, which is the absence of a heart contraction. The risk factors for a myocardial infarction include age, heredity, race, tobacco use, history of hypertension, diabetes, obesity, and hypercholesterolemia.
Hi, my name is Nadia, and in our demonstration, I'll be playing the roles of the dental assistant and the dental hygienist. I will be taking on the roles of P2 and P3, which include assisting the dentist, recording the patient's vitals, administering oxygen, recording events and times of medication delivery, as well as retrieving the emergency kit. Treatment of AMI. Terminate procedure. If there is a history of angina, follow protocols for angina. If no history of angina, contact EMS immediately. Position patient comfortably, probably upright or semi-supine. Assess, administer nitroglycerin from emergency cart, 3 doses over a 15-minute period. If pain diminishes and then returns, most likely AMI. Administer aspirin, chewed 325 milligrams. Treatment of AMI. If there is a history of angina, follow protocols for angina. If no history of angina, contact EMS immediately. Position patient comfortably, probably upright or semi-supine. Assess circulation, airway, and breathing. Administer oxygen 4 to 6 liters per minute via nasal cannula. Monitor vital Ms. Jordan, we're going to go ahead and go over your medical history today. How often do you have dental examinations? Do you go every 6 months?
Mhm.
Okay, every 6 months. And how often are you brushing your teeth?
Twice daily.
Perfect. Okay. And what about flossing? How are we not flossing?
Maybe every other day.
Alrighty. And our medications, have we took our medications today at all?
Yes, I took them this morning.
Okay, got it. And any recent surgeries in the last year? Okay. And back to our medications, do we have any drug allergies?
Aspirin.
Aspirin? Okay. Allergic to aspirin. Okay, I'll write that down. Okay. And how are we feeling today?
Honestly, not that good. I was super restless last night. I didn't sleep well, and I woke up kind of nauseous and just like with a stomach ache, and I'm not sure why.
I'm so sorry about that. Did you take any medication for your pain at all today?
Nothing for pain now.
Okay. Alrighty. Well, we're gonna get started on our vitals now, okay? But I'll let the doctor know how we're feeling today, okay? Okay, Miss Jordan, your pulse was a little bit high. I'm gonna let the doctor know about this. But I'm gonna go ahead and put your bib on, and the doctor will be in here shortly, okay? Okay. For your procedure, okay, we're gonna get started. I'm just gonna lean you back slowly. Just let me know if you feel any discomfort, and I'll stop, okay? Okay. Is it okay? Yeah. Oh. Are you okay?
My chest is hurting.
What does
And
it
it
feel
feels
like?
tight.
Your chest is feeling tight? Okay. All right. I'm gonna let my hygienist know to activate the emergency response system. I think that we're having a medical emergency.
Hang on, Doc. I'm
Are
sorry.
you okay?
My chest is hurting.
What does
And
it
it
feel
feels
like?
tight.
Your chest is feeling tight? Okay. All right. I'm gonna let my hygienist know to activate the emergency response system. I think that we're having a medical emergency. I'm gonna bring you up just a little bit in a semi-supine position. I'm gonna turn this light off. Go ahead and try to relax. You can take your glasses off. Nadia, go ahead and go get me the medical emergency kit.
On the way, Doc.
All right, Ms. Lubianski, I know that on your medical history it does say that you're allergic to aspirin, okay? So in normal situations we would give that to you because I think you're suffering from a angina pectoris emergency. Do you happen to have your own nitroglycerin?
Yeah, it's in my purse over there.
Okay, do you know how old it is?
Very old.
Very old.
Over
Okay.
a year, probably.
It might have been exposed to sunlight, so it might not be as effective as the one we have in the office. My hygienist is bringing it now. Here, Doc. Perfect. Thank you. All right. I need you to take this medication, okay? You can place it under your tongue. Okay? Get a little bit. We're gonna let that medicine kick in, okay? Do you need any water? Yes. Yes? Okay. I have some. Perfect. This Lubianski is completely normal to give you up to 3 doses, okay? So it's been 10 minutes. I don't see that it has any effect on your symptoms. I'm going to administer the second dose. The same procedures. Put that under your tongue, okay? We'll wait another 10 minutes. All right. You're still feeling that radiating pain down your arm. I'm going to administer the third dose. And
Just do what I do when I have problems.
3, 2, 1, go. No. Circulation.
Oh my god, bro. Oh, hell no, man. What the fuck, man?
Wait, what happened?
2,000 years later.